Warriors, I know it's been another week, but probably this will be almost like a final update video because my eye is actually getting completely better. I would say 95% better, and I'm not really wearing my glasses right now just because the prescription has almost completely changed on my left eye, but my right eye is still about the same. So for my left eye, the blood, I would say it's about almost 2%, 3% still there. It's almost like a little string line in the eye, but it's almost completely gone in a way. You would not even see it. Vision hasn't completely improved, but it's getting a lot better. I can almost read, I can almost see everything, and my lifestyle is getting almost back to baseline, I would say, before this second surgery of May 20th. But if you had to talk about from November 20th, before that, no, I'm not before that time because, as I mentioned previously, my eye has been almost permanently dilated in my left eye. So my left eye still gets light sensitivity. And when you have light sensitivity, it's very a struggle when going outdoors or doing anything outdoors due to the fact the light feels harsh on your eyes. So you would need to wear sunglasses just to make it easier on your eyes. Not only that, when you do have dilated eyes, it's harder to read. Think about it when you go to any optometrist, not an ophthalmologist, but an optometrist when you're trying to get new glasses. They dilate your pupils to see inside the back of your eyes, to see how your retina is doing. And when they dilate your pupils, they'll give you these temporary shades, could be plastic, to put on your glasses. And those temporary shades are to help protect from the sun because when your eyes are very dilated, it gets very sensitive to light. And not only when it's sensitive to light, it can be very blurry to read things up close. So that is what I'm also facing with my left eye right now. It's a little bit harder to read up close on my left eye. So I wouldn't say it's back to baseline before November 20th. Those are the very two significant changes. Cannot really see up close because it's blurrier than before, and light sensitivity. But if you were to say back to baseline from May 20th with the second graft revision and the CPC laser, I would say it's getting closer, but the vision has gotten blurrier because the glasses feels like it's not helping. So I'm not completely back to baseline on that part. So I mentioned all this in a way for you to understand when it comes to complications throughout any surgery. It can be laser, it can be a tube shunt surgery, it can be a trabeculectomy, it can be a minimally invasive surgery. But anything will have its pros and cons, and doctors will always weigh out the options to protect your eyes. Sometimes protecting your vision would feel like it's gonna be like they can't protect the way you want to see clear, so it'll get blurry after the surgery, but they're protecting your vision long term, as in the optic nerve, so that you can still see longer. So those are just the things that some doctors weigh out. So I know how you feel and how I feel, because when it comes through surgery and complications, we don't like that. And the fact that we do get these surgeries, our vision changes regardless of how the surgery outcome becomes. Laser, it can become more light sensitive. You get any corneal transplant, the suture doesn't attach properly, your eye becomes itchy, you start to rub it more. And all this becomes a big factor. And if you're getting a tube shunt surgery, sometimes your eye just heals differently, and then that scarring just covers up that shunt that you'll need to go back and do some revisions as well. So this is just my personal experience when it comes to a graft revision surgery. And I want you all to know each person is different on their own case by case situation. And I do also want you guys to understand, my warriors, that some surgeries are good. I'm not saying to avoid surgeries in general and to avoid all laser in general. If I could, I would. That's something I don't ever want to do. But when you're on max dosage eye drops, then you can't really do anything left. You can't just keep adding on eye drops and get to like 10 different eye drops. You're on so many eye drops from beta blockers and other drops to help slow down the pressure, because I'm already on 4 eye drops, as I mentioned before to you all, from Remonadine, Latanoprost, Cosopt, Ropressa. I'm even on a pill, methazolamide. All these drops do different things. These drops sometimes slow down the aqueous humor from spewing out liquid, and some of them increase the flow of liquid. So they all do different things in a way to keep the pressure in a stable condition around 11 to 15. But sometimes, even when you're on a lot of drops, it doesn't help, and that's when you go to different scenarios. But in my case, I needed laser because I had 2 tube shunts I mentioned before in both of my eyes. I had I believe the Alphagan shunt and Bayvert shunt. I don't know if I'm pronouncing the second one correctly. So during the bottom corner and the top corner of each eye, I asked about adding more shunts, and I asked about different lasers before doing the CPC laser. But they said a shunt could be even more complicated just because I already have 2. So I always ask questions, and that's where I want you to always ask questions as well. I want you to advocate for yourself, because I want to make sure you all protect your vision, because your vision is something you have to really maintain and cherish for a long, long time. And when you grow old, you'll still have 100% of your vision. It's not something you want to lose at all. So sooner or later, I'm also going to have to do my right eye, probably CPC laser. CPC laser is more of a aggressive kind of laser compared to SLT, where you can do in clinic, but CPC you have to do outpatient in the surgery room, but it still takes less than 10 minutes to do, so it's just more aggressive. That's all it is. Do I recommend all these scenarios? Not personally, but when you're left with no options, then yes, that's when I do recommend it, just because you have a lot of like outcomes to weigh out. So I did want to update you guys on my eye and how it is doing right now. It's doing a lot better than how I was previously. Had it with the first hyphema, and if you want to know how hyphema is spelled, like, it's HYPHEMA. That's just where blood starts getting between the anterior chamber, so between the eye and cornea. So it's not passing through, but you can still see light, but it's not being where it's blacked out. No retina has torn. And sometimes when you have this, it's not the best news, but it's better than tearing your retina. That's what I would say. So my eye is almost completely clear. The yellow is a lot better. It's not as yellow. Do I see a little color difference as I'm closing each eye? A little bit. I'm hoping it'll get better in probably another 2 weeks, but let's just wait and see and pray together, because I know you, all of my warriors, are praying together with me, and I've been reading all of your comments and trying my best to get back to all of them. And reading each of your story is always motivating me and inspiring more to keep on going, not just for myself, but for you all, as I want to be that light for you to keep on going. Thank you so much. And if you enjoy these update videos, I'll keep making them continuing forward. I want it to be my last one on this eye, but if you like me to just make regular update videos, sometimes every month, every 2 weeks, I can as well. Just let me know down in the comments below. And I'm hoping that this mic is improving, as I want this content quality to be better for y'all. Thank you, and drop a comment if you also share any complications with your surgeries, and subscribe if you enjoyed it.